Why do we breathe, and how is the brain involved? When we breathe, we move air in and out of our lungs. This allows us to take oxygen into our bodies and get rid of carbon dioxide. Oxygen is then transported throughout our bodies in our blood. Breathing is controlled by the brain. Most of the time, we don't even realize our brain is involved. But sometimes we stop and think about it. We hold our breath to swim underwater or take a few calming breaths on a busy day. Parts of the brain, known as the respiratory centers, send messages to the muscles in the chest. As these muscles contract and relax, we breathe in and out. The respiratory centers sense the amount of carbon dioxide and oxygen in the blood so that the rate and depth of breathing can be changed. For example, when we exercise, there is an increase in carbon dioxide in our muscles, so our brain sends messages to the respiratory muscles so that we breathe faster and deeper. How often do we breathe? Adults typically take a breath around 12 to 18 times per minute. We have a regular breathing pattern. When a baby is first born, they naturally breathe much faster, at around 40 to 60 breaths per minute. The rate of breathing gradually decreases through childhood, and adolescents have similar breathing rates to adults. Newborn babies also breathe with an irregular pattern. Sometimes they take breaths together quite quickly, and sometimes they have short pauses in breathing of a few seconds. It is also normal for babies to vary the depth of their breaths. What is an apnea, and how are babies monitored in hospital? Apnea is a pause in breathing. It is very common in premature babies, affecting almost all babies born before 30 weeks gestation, and more than half of those born before 36 weeks gestation. Apnea can also occur in older babies, and may be more likely at certain times, such as when babies have infections or other illnesses, or when a baby starts to learn how to feed. Apnea can occur frequently, often multiple times a day, and may continue for a number of weeks or months. Every baby is an individual, and the age at which they stop having apneas will be different. Apnea can lead to decreases in oxygen levels in the blood, and can sometimes cause a baby's heart rate to lower, which is known as bradycardia. For this reason, babies are carefully monitored whilst they are in hospital. Vital signs monitors are used to continuously measure babies' heart rate, breathing rate, which is known as respiratory rate, and their oxygen saturation, which is a measure of the oxygen levels in their blood. An alarm will sound if the machine senses that any of these observations are higher or lower than expected. This alerts the neonatal team so that they can come and check the baby. Why does apnea occur in babies? When a baby is born, particularly if they are born very prematurely, their brain and lungs are still developing. Babies practice breathing in the womb, but are not used to doing this all the time. This means that the connections between the brain and the muscles that control breathing are not as strong as they are in adults. An adult's brain is able to sense how much oxygen and carbon dioxide is in the blood using special sensors. The brain can send a message to the lung muscles to tell us to breathe faster if the balance between oxygen and carbon dioxide is not quite right. In premature babies, these sensors are not yet fully developed. This means that unlike adults, they may not change the way they are breathing when they have lower levels of oxygen or higher levels of carbon dioxide in their blood. Similarly, premature babies' lungs are still developing and might need extra help to stay open. There are lots of ways in which doctors and nurses treat apnea to give babies' brain and lungs time to grow and to give babies time to learn this new skill. Research in Oxford. Researchers at the University of Oxford are trying to better understand how babies' breathing changes as they develop on the neonatal unit. We are also trying to understand how this relates to their brain development. We use a technique called electroencephalography, EEG, to record a baby's brain activity while they are in their cot or incubator. EEG can measure the natural electrical activity in the brain. This involves gently placing sensors on a baby's head, similar to an ECG, the sensors used to measure your baby's heart rate. We can use EEG recordings to see how babies' brain activity changes with age. We can also see how they respond to the outside world. For instance, by gently touching the baby's foot. Even very young premature babies show a brain activity response when they are touched or when they hear a sound, like a parent's voice. In our research studies, we are able to look at how babies' brain activity develops along with changes in their vital signs, including their breathing. By understanding how breathing and the brain develops in premature infants, we hope that treatment for apnea can be optimized for babies.